Early mobilization after abdominal surgery. As an introduction, abdominal surgery is a common medical procedure that comes with a high risk of postoperative complication. The complications significantly affect patients' outcome and recovery. There have been efforts to reduce the nature and severity of post-surgery complications. Early mobilization has garnered increasing attention as an EBP method of reducing such complications. Postoperative complications are a significant burden on surgery patient and healthcare systems. Post-surgery complications occur in approximately 7 to 15% of all abdominal surgery patients. The implication is prolonged hospital stays and increased healthcare costs. Studies also indicate how morbidity and mortality rates are in 1 year. The pivot question that frames the discussion is, in post-abdominal surgery patient, does early mobilization and ambulation within 6 hours post-surgery compared to standard postoperative care reduce the incidence of postoperative complication within 7 days post-surgery? Background and significance. Abdominal surgery is the most common surgical procedure performed in the United States. It encompasses a wide range of procedures that are either elective or urgent. The common procedures in the United States are gallbladder removal and appendectomy. Regardless of the reason for surgery, patients may experience postoperative complication and a prolonged recovery time. Early mobilization significantly reduce post-surgical complications. This is a major concern for both patient and healthcare providers. It promotes a quick recovery and improved functional outcomes. It makes early mobilization a key factor in patient well-being. Improved well-being helps nurses address complications like infection, blood clots, also known as DVTs, and lung collapse. Most of these complications are associated with prolonged bed rest. It is also notable that early mobilization fosters patient autonomy and participation in their recovery journey, thus leading to regaining functional independence. Early mobilization and APRN role. APRNs are well suited to champion early mobilization due to their expertise, leadership, and collaborative approach. These skills enable the integration of evidence-based guidelines and individualized plans. APRNs also facilitate timely mobilization and address patient-specific needs. APRNs also play a key role in educating patients and teams about the benefits of early mobilization. This education promotes patient cooperation and participation, which improves self-rate health and thus better recovery. They also advocate for policy changes and drive quality improvement initiatives to enhance surgical care outcomes. Case presentation. Ms. Jones. Ms. Jones is a 28-year-old healthy woman who underwent laparoscopic appendectomy for acute appendicitis. The patient was referred for surgery on an emergency basis after presenting with acute appendicitis. The surgery was largely successful, and the patient was poised to be discharged in the next 4 days if she recorded no complications. The patient is apprehensive about getting out of bed due to post-surgical pain. She reports the pain as 5 out of 10. She hopes she returns to work in a week and hopes to have healed by then. She expresses concern about wound healing and potential complications if she mobilizes too early. The nurses apply current research that support early mobilization after abdominal surgery to reduce complications and improve recovery. However, patients may harbor misconceptions and anxieties hindering participation. The APRN are tasked with educating the patient about the importance of early mobilization and how it might affect their health. The education resulted in an agreement with the patient that she would walk around the unit for 50 meters every day. Case outcome and implications. After successful education, mobilization was initiated 6 hours after surgery. The patient was able to walk freely after 12 hours and without apparent complications. The nurse assesses for complications such as clot formation, DVTs, wound infection, and also general patient well-being. The patient was discharged after 3 days with a positive prognosis. This case directly relates to the PICO question and available literature. Ms. Jones' case exemplifies the potential barriers to early mobilization and the role of APRNs to addressing them. It indicates that early mobilization is associated with positive outcomes, such as faster recovery and reduced length of stay. This directly impacts healthcare resources and costs. Review of the literature. The benefits of early mobilization are widely recognized. Successful implementation on this intervention hinges on established standards, standardized protocols, and evidence. Most clinical practice guidelines, CPGs, emphasize key areas for achieving optimal results. A CPG by the Society of Critical Care Medicine advocates for the safety and potential cost effectiveness of early mobilization. This aspect encourages healthcare institutions to embrace the practice with the main concern of patient safety. The CPGs highlight the importance of establishing clear safety criteria. They also express situations where early mobilization may be contraindicated or require modifications are needed. The CPGs further emphasize the value of a structured approach. This involves developing a step-by-step protocol outlining the type and intensity of movement patient should undertake at different stages of recovery. A structured approach promotes consistency and facilitates communication between healthcare team members. Also, CPGs recognize the importance of collaborative teamwork. Continue reviewing the literature. The American Society of Colon and Rectal Surgeons and the Society of American Gastrointestinal and Endoscopic Surgeons have established a clinical practice guide that sets the best practice for abdominal surgeries. The CPG indicates that getting patients moving soon after surgery within 24 hours is linked to shorter hospital stay. This is a strong recommendation based on available evidence. The prolonged bed rest can lead to various complications such as muscle weakness and breathing issues. There are also risks of blood clots and reduced body strength. Studies show that patients who move early after surgery tend to recover faster and experience fewer complications. For instance, a study linked height step count on their first day after surgery with shorter hospital stay. The CPG posits that there is limited data on specific interventions. There is also limited information on the specific interventions, specifically designed to increase movement. Lack of early mobilization is associated with increased risk of complications such as respiratory failure and even death. This finding is corroborated by a study that links between postoperative atelectasis and pneumonia in surgical patients. The study sought to determine if postoperative atelectasis increased the risk of pneumonia, increased rate of ICU admissions, and hospital stay length. They found that most patients contracted pneumonia within 30 days of surgery. The secondary were ICU admissions and lengthy stay in the hospital. Postoperative complications are significantly associated with an increased mortality risk within 1 year after surgery. The main finding was that 18.9% of patients experienced complications within 30 days. The patient with complications was nearly twice as likely to die within 1 year of surgery as compared to those without complications. Another key finding was the patient with respiratory failure had the highest risk of death at 21.4%. Getting the patient to move a few hours after surgery improves pulmonary function, mobility, and functional independence within a short period. A study investigated whether early mobilization improved their respiratory function. The findings indicate that patients who were mobilized early had significantly better blood oxygen levels compared to the control group. Mobilization led to some improvement in blood oxygen levels. The mechanism of interest in that early mobilization reduced stress on the pulmonary cavity, thereby reducing the risk of failure. This is highly possible when the patient is at bed rest for a prolonged period. Early mobilization is a core principle of enhanced recovery after surgery protocols. These protocols aim to minimize surgical stress and speed up recovery. However, there is often a lack of awareness and resources that can hinder early mobilization. The solutions to the challenges include education, clinical tools, and wearable technological devices for monitoring activity. Combining enhanced recovery after surgery protocols with pre-surgery exercise programs and emphasizing structured mobilization plans in enhanced recovery after surgical protocol guidelines are promising advancements. Review of literature, research gaps. Despite the extensive literature on early mobilization of surgery patients, there exist multiple research gaps that are identifiable. Research is needed to determine the long-term impact of early mobilization on factors like functional ability and quality of life. Many studies tend to focus on the short-term implications such as length of stay in hospitals and the intervening period. However, it is important to consider the wider impact that may stretch outside the recovery period. The research found one study that considered the impact of early mobilization of surgery patients 1 year after surgery. Another gap was the most research focused on general surgical populations. Only a few studies consider studies dealing with the specific patient population after surgery patients. The current literature also lacks information on the ideal frequency, duration, and intensity of activity for different patient populations. Further research can help determine the appropriate activity scale for early mobilization to maximize those benefits. Implementing evidence to APN roles. Incorporating evidence-based decision-making into clinical practice is essential to optimize patient care and promote positive outcomes. An effective implementation model requires an appropriate implementation model. The Royd adaptation model serves as the theoretical framework for guideline this EBP decision-making process. The model is anchored on the role of adaptation. It shows that individuals strive to maintain their physiological and psychological integrity in response to a stressor. It is considered that abdominal surgery is a major stressor for the patient. As such, the patient may react to the stressor by adapting to other strategies that would reduce or eliminate the stressor. Early mobilization aligns with this model by promoting adaptive responses to surgical stressors. Adaptation facilitates faster recovery and reducing the risk of further complication. Implementing EBP, the plan of action. The initial step in the plan of action is to determine the clinical problem. The clinical problem is the risk of postoperative complication in patients undergoing abdominal surgery. The risk is considered higher for patients who are immobile due to the lack of mobilization protocol or because the patient factors that hinders mobilization. The second step in the search for evidence. This entails a systemic literature search to identify high-quality evidence supporting the effectiveness of early mobilization. This includes randomized control trials, meta-analysis, and clinical practice guidelines. The nurses must also consider the available CPGs that delineate the best practice for applying the intervention in the clinical setting. The identified evidence is critically appraised using validated tools to assess its validity and reliability. The appraisal also considers the clinical applicability of these findings. The priority is made to studies that demonstrate the benefits of early mobilization in reducing complications and improving patients' outcomes. Implementing the EBP, the treatment plan. This is the most important part of the implementation. It requires the APRNs to demonstrate key competencies and skills. It is based on synthesized evidence and clinical practice guidelines. This plan includes early initiation of mobilization within 6 hours post-surgery. The patient is required to progressive ambulate under supervision. The nurse manages the process by first initiating an assessment of the patient's conditions, vitals, and pain ratings. The nurse also considers the patient's ability to tolerate movements such as physical well-being and sanctions by a physician. The nurse also considers the pain rating and institute or implement pain management strategies to facilitate mobility. The next step is to conduct patient education on the importance of early mobilization for optimal recovery. Successful preparation readies the patient for actual mobilization. The implementation phase requires the nurse to help the patient move for 50 meters every every 6 hours post surgery. It is expected that the patient will be able to walk longer, over 100 meters, and without support after 12 hours. A pedometer may be used to track the distance a patient covers. Ethical considerations. Implementing early mobilization after surgery offers a wealth of potential benefits for patients. However, numerous ethical considerations require careful navigation. Some ethical issues that may cause serious issues include privacy issues, workforce shortages, and accidental falls. The use of technology offers insights into how many steps or yards the patient have ambulated and the frequency. This technology helps reduce staff requirements and is more accurate in tracking progress. However, this technology is a major issue for patient privacy. There is a risk that the data can be used to track patient movement and leak to non-essential staff. This will be a violation of HIPAA, and they may open the organization to lawsuits and fines. It is important to explain to the patient the benefits and risk of using such devices, and of course, obtaining informed consent is an essential part of this plan. Additional ethical considerations. Workforce shortages and resource limitations within the hospital pose challenges. Mobilizing patients early can create undue strain on already stretched staff. Unsupervised mobilization is a major ethical issue, whether nurses may be accused of negligent behavior. Such negligence may lead to additional issues such as patient faults. This exposes healthcare organizations to litigations and possibly risking the nurses' careers. There is also an ethical concern related to the principle of justice. The limited resources may prevent some patients from beneficiating from early mobilization. Nurses leaders must play a critical role in advocating for policies and standards that prioritize patient safety and well-being. Some of the policies require interprofessional collaboration with physicians and physiotherapists. Concluding, the discussion considered whether early mobilization improved patients' outcome. Evidence-based practice principles were applied to demonstrate the benefits of early mobilization. The research found that most studies support a positive association between early mobilization and shorter stays after major surgery. It also reduces complications, improves pulmonary function, and accelerates recovery. The discussion also outlined and discussed the roles of APRNs in this intervention. APRNs can critically appraise research, translate evidence to patient care, and develop individualized mobilization plans. Also, effective communication with patients and collaboration with other healthcare professionals are essential competencies for successful EVP implementation. There are also associated issues that touch on the ethics of early mobilization. The research outlined the risk of privacy breaches and equitable access to resources and staff for safe mobilization remains a concern. And continuing, you will see my references. Thank you for your time.